In the United States, crossing a single county line can statistically erase 10 years of your life expectancy. In some counties, the average person dies before they reach 68, lower than in parts of sub-Saharan Africa. And the difference between living and dying often comes down to one thing: how far you are from a hospital. A heavily pregnant woman struggles to breathe in the backseat of her car. Her due date was supposed to be in 4 days. Instead, she dies in the back of that car, just 3 minutes from the hospital. It shouldn't have happened. You wouldn't expect this anywhere with a functioning healthcare system. But this woman? She was from Humphreys in Mississippi, a county where the medical advice is to drive like hell. This is what a hospital shortage in the United States looks like. Americans spend at least twice as much per person on healthcare than just about all other high-income democracies. It's a fact. But despite all that heavy spending, the US ranks near the bottom of those same countries when it comes to overall health outcomes. More money equals worse health. But this isn't a story about the whole country. Not all Americans are born equal. Location matters. The problem of health in America isn't confined to neighborhoods. It's about entire states. But zoom in, and it's also about counties. Counties where statistical health data is comparable to some of the poorest nations in the world. Between states, you might see a 10-year gap in life expectancy. Cross from Mississippi into Tennessee, or from West Virginia into Virginia, and within a few miles, the statistical difference in how long you'll live can stretch to a decade. The border changes the outcome completely. For example, if you're born in Massachusetts, Connecticut, or New York, you'll likely live to around 79 or beyond. If you're born in Mississippi, West Virginia, or Alabama, you might not reach 71. And in some counties, that gap doesn't stop at 10 years. It doubles, it triples. And this is not about a handful of people. Millions of Americans can expect to live a relatively short life, and this is where the system stops working. The data points to 3 specific ground zeros where the system has already flatlined: Pemiscot County, Missouri, McDowell County, West Virginia, and Humphreys County, Mississippi. You don't know them, but if you were born there, they would define how long you live. In America, your zip code is one of the strongest predictors of how long you'll live. It's stronger than your genetics, stronger than your lifestyle, stronger in many cases than your income. Data shows that if you are born in Pemiscot County, Missouri, there is a very good chance you won't be seeing your 80s. Statistically, that's a very high probability you'll have died many years earlier, because the average life expectancy there is just 67.4 years. Right now, this county on the Bible Belt is home to almost 15,700 people. It used to be a lot more, but over the years, people have been moving out. One of the reasons is poverty. With the average per capita income standing at just $26,000, it's one of the poorest counties in the US. And it's also one of the worst places to find healthcare. Its only hospital has been on the edge of closure for years. If it shuts down, the nearest emergency rooms are 20 to 50 miles away. And in a medical emergency, delays kill. Heart attack, heavy bleeding, overdose, sepsis, all survivable if they're treated quickly, if not, deadly. And if you have a chronic illness, receiving regular treatment can be difficult. The patient-to-primary care physician ratio is 2,500 to 1, almost double the US average. More than 80% of US physicians practice in urban areas, a geographic concentration that mirrors the hospital closure map and leaves large rural regions critically underserved. And Pemiscot is by no means the worst. Throughout the entire Mississippi Delta region, receiving medical attention can be hard work. If you're born in Humphreys County, the life expectancy is just 67.2 years. In 2013, the county's only hospital closed down. No emergency room, no backup. If something happens, you'll now find yourself racing across Delta farmland to the nearest hospital about 25 to 45 minutes away. And the pattern still doesn't stop there. McDowell County in West Virginia lost its coal industry and never recovered. 17,000 people left behind in a place where the economy collapsed and the healthcare system collapsed with it. The life expectancy here is mid-60s. lower than some developing nations. Health outcomes are extremely poor here. It's not just a problem of drugs, but obesity, mental illness, nutritional deficits, and chronic disease. These people need hospital care when they fall ill. They need physicians to direct them, but their only choice, the Welch Community Hospital, is reported to be under severe threat after a planned rescue takeover fell through in 2024. There is no OBGYN in the country. Women drive over an hour to give birth. This pattern repeats across a geographic arch stretching from the Mississippi Delta through central Appalachia, a corridor where life expectancy maps fit almost perfectly onto hospital closure maps. It's the same for millions of people scattered all over the rural South who are now facing a future where their one local hospital is teetering on the edge of extinction. There are only about 2,000 rural hospitals in the entire United States. That means nearly a third of the system is either gone or on the brink, especially in the Mississippi Delta, Central Appalachia, the Texas borderlands, and parts of the Great Plains. And when they do close, the shocking life expectancy rates in the rural South will likely dip even lower. When a hospital closes, it doesn't just remove a building, it removes time. It removes survival. In Clark County, Alabama, the Thomasville Regional Medical Center opened up in 2020. The residents of the county were relieved to have what the media said was state-of-the-art equipment. But by 2024, the hospital was closed. Right now, in Clark, if patients have a major trauma emergency, they have to travel 90 minutes to the city of Mobile. This extended waiting time could mean treatable conditions becoming permanent damage or someone needlessly dying. Where life expectancy rates are grim, there's almost always poverty. And when there's poverty, a lot of people use Medicare. 2.6 million Medicare surgical patients in rural areas traveled an hour on average just to reach care. And a third of all Americans are now believed to lack access to timely, affordable surgery. In Alabama, a state that has some of the lowest county life expectancies, 23 rural hospitals, about half of the state's rural total, are on the list of being barely able to stay open. If you overlay the 2024 legislative map onto these hospital closures, a new crisis comes into focus. Under that proposed legislation, Medicaid spending could be cut by over $100 billion over the next decade, and rural areas will likely be the hardest hit. If Congress reduces the federal matching rate, meaning the share the federal government pays, states will be left to make up the difference, and some won't be able to pay. When the Affordable Care Act was introduced in 2010, some states refused to expand Medicaid. The rationale was more people on private insurance would mean less pressure on the state budget. Whether those states were right or wrong, the result was the same. Millions of people were left without coverage in the parts of the country that needed it most. But the other states that did expand Medicaid are now facing cuts that could take the coverage away. That's not a coincidence either. It's a policy decision wearing a geographic disguise. The result could be millions of Americans losing health coverage, and by 2034, that number could reach 16 million. This is in a country where millions of people already have a life expectancy lower than in some of the poorest places on Earth. Rural hospitals are simply not profitable. It really is that simple. They rely heavily on Medicaid and Medicare, and those reimbursements often don't cover costs. So they lose money. They either pull down the shutters or they're bought up by larger healthcare systems. On paper, it can look like a rescue package, but in practice, it's consolidation. And that means cutting what doesn't make money. So, the rural hospitals close. Naturally, the collapse follows the money. In rural Mississippi, a woman lies on the floor. She's not breathing. A belt is strapped around her arm. A hypodermic needle is discarded on the floor next to her. The nearest hospital is over an hour away, down long stretches of country road. The ambulance will get there as fast as it can, but the crew, volunteers, and part-time EMTs, they're miles away. The 911 operator talks the husband through chest compressions. 3 hours pass before the ambulance arrives. By the time she reaches the hospital, she's had a stroke. The blockage has been there long enough that millions of brain cells are already gone. Nothing she's still not moving, not breathing, and then something. A breath, a facial twitch. She's alive, but barely. You roll her onto her side, keep her airway clear, watch her chest struggle to rise and fall, but something doesn't feel right here. It's hard to explain, but her face looks strange, droopy, weak. In stroke belt counties, stroke mortality runs 40% higher per 100,000 residents than the national average, almost entirely because of distance. In rural stroke belt counties, average ambulance transport times exceed 45 minutes, 3 times the urban average. In the most isolated areas, a 3-hour total trip to a specialized stroke center is not the exception. That is the reality. The EMTs strap an oxygen mask on the woman, check her vital signs, and ask you questions as they load her onto a stretcher. In the back of the ambulance, they hook her up to a monitor. An ECG prints out across a strip of paper. They can't say exactly what's wrong, but it doesn't look good. The local health clinic can stabilize her, but she'll need to get to the main hospital as soon as possible. That's another hour away. She makes it, and she's stable, but this is just the beginning. The CT scans shows she's had a stroke. The MRI shows a blockage. She'll need medication. Monitoring, rehabilitation. Days, weeks pass. She has memory problems, fatigue, weakness down one side. The drugs and rehab will help, but there's no guarantee she'll ever fully recover. And this is already getting expensive. She falls into the coverage gap. The bill is on her. The ambulance ride alone cost over $1,000. The ER visits, the scans, the bed, the drugs, that's tens of thousands more. And now the rehab she'll need, the physical therapy, the follow-ups, it's more money than she could ever earn. Especially now she has brain fogginess and struggles to concentrate. The doctor told her that getting to the hospital sooner might have made a difference. In rural stroke belt counties, average ambulance transport times exceed 45 minutes. Again, 3 times the urban average. And with a stroke, time matters. Every minute without treatment costs roughly 1.9 million brain cells. This reflects a reality for many people in rural America. Mississippi sits in what's known as the stroke belt, along with a cluster of other states across the southeast, all caused directly or indirectly by a combination of low socioeconomic status, poor nutrition, obesity, and hypertension. And when it's hard to access healthcare, small problems can quickly turn into big ones. If people had access to primary care instead of relying so much on expensive rescue medicine when things are already bad, they might not become so ill in the first place. In this current treatment first, not prevention system, the insurance companies win. The pharmaceutical companies win. But the people lose. Prevention could solve so much of America's health crisis. So many lives could be saved before they ever began to fall apart. The thing is, in America, healthcare isn't just care. It's incentives, it's lobbying, it's power deciding what gets prioritized and what gets ignored. And in this system, money and bottom lines decide everything. The result is almost unbearable when you sit with it long enough. People dying early from things that should have been prevented, conditions that should have been caught, lives that should have been protected but weren't. Even with the most advanced medical technology in the world, the system still fails the people inside it. Where you're born shouldn't decide how long you live, but for millions of people, it does. We at least have the belief that living in a highly developed country, this shouldn't be the case. By 2030, projections suggest up to 700 more rural hospitals will close. There are already counties in Mississippi and West Virginia with 0 practicing physicians, not a 1. The map isn't just getting worse. In some places, it is already blank. The pregnant woman who died 3 minutes from the hospital is an example of how the US geography failed her. The most unsettling part is how easily we can live inside something that decides who gets more time and who doesn't. Thanks for joining me today. I hope you enjoyed the video, and if you want to see more videos like this, then please consider subscribing and turn on notifications. It really does make a difference. Thanks again, and I'll see you next time on MatPack.